Hello, I'm Dr. Matt Hogue with Hogue Chiropractic Center. I'd like to talk with you today about a condition that we see every day, and it's arthritis, osteoarthritis to be more specific, which is your run-of-the-mill wear and tear type of arthritis. Now, if you've been told by a doctor before that you've had and deal with and still have arthritis, were you told why it's there? Our job is to focus in on causative factors whenever we're treating a patient and we deal with arthritis. That's ever so important that we focus on that cause. What is the cause? Well, let's talk a little bit about what we have up here, these x-rays. We're going to talk a little bit about a normal balanced spine and the forces that go through that spine versus a spine that isn't necessarily as it should be. Here to the left, we have a normal curvature, which is called a lordosis. We can see that the upper neck is kept in balance to the lower neck and effectively keeping the head in balance to the shoulder. The weight of that head compresses through the weight-bearing structures on the inside aspect of a healthy curve, and that weight is distributed evenly, and that's how we're designed to be positioned. If we look at this x-ray to the right, we see unfortunately a reversed cervical curve or a cervical kyphosis. We can see that the upper neck is kept in balance to the lower neck and effectively keeping the head in balance to the shoulder. The weight of that head compresses through the weight-bearing structures on the inside aspect of a healthy curve, and that weight is distributed evenly, and that's how we're designed to be positioned. If we look at this x-ray to the right, we see unfortunately a reversed cervical curve or a cervical kyphosis. Has many different causes. Falls, auto accidents, traumas can create these changes over time by weakening the soft tissues that hold that spine in its normal and rightful position. And in this case, that is what's happened. Multiple traumas actually, but what's happening as far as the pressure through this neck, the weight of the head pressing on the inner aspect of this neck that's reversed, is causing change. Osteoarthritis, one of the biggest causes is going to be some form of trauma some point in your life, lack of motion taking place in a joint or a joint's inability to motion properly. Too much motion because of ligament laxity or damage can also generate and cause arthritic change. In this case, the weight of the head day in and day out being placed on the inner aspect of this reversed curve is driving a change at the bone level. A law of the body teaches us, it's called Wolff's Law, that states pressure on bone will cause the body to place more bone down. So the weight of the head being placed on the front aspect of that neck when this curve is reversed is what's causing these changes to develop. When we deal with osteoarthritis and other joints in the body, it's usually a stress, a pressure being placed unevenly, some trauma at some point that's happened that's weakened that joint integrity, and over time the body's trying to fix it on its own. And unfortunately, that's putting bone in a joint articular surface. Again, that is technically osteoarthritis. We do our evaluations on our patients, whether it's through the foot, the knee, the ankle, the spine, the lower back, and into the neck. Our job is to evaluate our patients to see if there's an underlying cause to that problem. Osteoarthritis has many causes, and most of those traumas over time tend to be the ones that give our patients the most change arthritically over time. Focusing on those causes is our goal here at Hogue Chiropractic Center. Feel free to give us a call. We'll be happy to set you up for your assessment to see if there's something that we can do to help reduce your arthritic change in your body. At Hogue Chiropractic Center, we help to unlock your body's potential.